Hello, doctors. Hope you all are fine. And I am pretty sure that all of you would have given the exam as per your best knowledge and belief. And when the results are out, all of you are going to come out with flying colors. I have the tremendous belief in you, beta, because over the last 4.5 months, for the 5 months, you had shown great character in you, and definitely the hard work will be turning into your success once the results are out. Now, coming to the recall session, already the exam has been finished. Now you cannot do much, but please let us try to understand the mistakes that you would have done. This time the exam was on the moderate side, particularly the paper 1, which usually tends to be quite easier as compared to the paper 2. This time it was a different story altogether, and the paper 1 was a bit tougher as compared to the paper 2. And paper 1 is the maximum area from where majority of the students, the bulk of the students, they actually score high marks. So nothing to panic, you have done already your best. Now just wait for the results and keep calm and enjoy the moment till the results are out. And definitely once the results are out, you are going to enjoy much more. Now coming to the recall session, for the biochemistry side, this time there were around close to some 17, 18 or 19 MCQs were asked. Few overlapping topics were there. Few feedback that I had received from the students that the number were close to 20, and a lot of overlapping questions were there. And this time the language of the questions were also on bit on the longer side. That's why recalling the question and remembering the question with its option this time would have been very difficult. So in this effort, I sincerely thank all the Miss students who had come forward in helping me with recall of as much as MCQs that were asked from biochemistry, and also coming as much as close possible to the real MCQ that were asked. So sincerely thanking all the Miss students who had helped me in this endeavor. Without you, it wouldn't have been possible. So just let us have a quick recall of the biochemistry session and let us look at the MCQs. I have tried to keep the essence intact, but as this time most of the questions were lengthy, some languages, some literature in the MCQs that I am going to show you now might be little difficult from the actual MCQ that was asked in your exam, but the essence of that particular MCQ I have tried to keep intact. Right. So coming to the first question, definitely you would have made this particular question correct, beta. I have tremendous belief in all of you, beta. A boy with black discoloration of the eye, skin and pinna of ear. Please try to understand eye and skin. We had seen particularly black discoloration related to protein metabolic related disorder wherever we have something known as uchronosis, right, beta? Please try to understand. They had also given you history that the urine sample was turning black at room temperature without adding any reagent. If you just don't close the lid or the container cap, and if you keep it open, the urine sample, due to accumulation of homogentic acid, ultimately it will be converted to alkaptone. So this was a question of alkaptonuria. They had asked about the metabolite most likely to be found in this patient's urine. I believe all of you would have marked the answer as homogenticate or homogentic acid. This was the feature of uchronosis, right, beta? You all know there is a black color deposition. Most common site is pinna of ear. Then we have intervertebral discs or the cartilages. We also have palmoplantar pigmentation, beta, around this zone we had seen in our classes. Also over the sclera, also ulceration in long standing cases, as well as there is overall black discoloration of the skin, right? So this is the question. So this was a question on alkaptonuria. This was a question on alkaptonuria, and I believe all of you would have made this one correct, right? PHPP is not the active metabolite here. 5-HIA, hydroxyindole acetic acid. This question was also asked in your exam. I'll be showing you the MCQ at a later stage, beta. But please remember this 5-HIA, hydroxyindole acetic acid. This is an active metabolite which is secreted out through urine in case of argentophenoma or in case of malignant carcinoid syndrome, right? So there was another question, and particularly if you remember, beta, phenyl acetic acid, this is actually seen in case of phenylketonuria or PKU patients, where we have the maple or the mousy odor in urine. Please try to understand the maple syrup urine odor. It is a different question, that is the branch chain amino acid. But phenyl acetic acid, if you try to recall beta, this is classically seen in case of phenylketonuria patient. Phenylketonuria patient where we have the mousy odor in urine. Just try to make you remember this. This is for the mousy odor or the musty odor in urine. Mousy odor or the musty odor in urine seen classically in case of PKU. Seen classically in case of PKU or the phenylketonuria patient. 5-hydroxyindole acetic acid, this is classically seen in case of malignant carcinoid syndrome or argentophenoma right? And parahydroxyphenyl pyruvate PHPP, it is not asked as an MCQ, so I'm not going into that. Please remember maple syrup urine disease, this time it was not asked beta. Many students were having some confusion, so please remember maple syrup urine disease was not asked here, right? This is homogentisic acid, case was alkaptonuria, right? Moving to the next question. Pretty sure all of you would have made this one correct. Straightforward image based questions. As of now, almost NBE has patented this image. I mean, many exams they have repeated the same image and they have asked vitamin deficiency following condition. All of you know the rashes over hand as well as the Casal's necklace that is there ultimately, and we all know the answer to this question. It has to be marked as niacin, and I believe all of you would have marked this one correct, right? No confusion here beta. Pellagra picture was given. I hope this exact image was given or maybe somewhat close to this. Hope all of you would have made this one correct. No confusion here, right? Now, this time there were a lot of questions from vitamins as expected, but vitamins we had also discussed along with the metabolism. I hope all of you would have got the correlation right and you would have all made it correct. Presented to OPD with tendon weakness and ataxia. Tendon weakness and ataxia. Please try to understand whenever we hear this word tendon weakness, ataxia, and also one episode of unconsciousness, the first thing that we should think about is the Wernicke's encephalopathy, right? We have some things known as Wernicke's encephalopathy, right beta? Wernicke's encephalopathy. I told you the mnemonic, we have something known as GOA, right? All of you would have remembered this. Global confusion, we have ophthalmoplegia shown as nystagmus and also ataxia, right? Please try to understand here they would have given only ataxia. The feedback that I had received from the students that these two words had been repeatedly told by many students: tendon weakness, ataxia, and there was one episode of unconsciousness. This is a debatable one, unconsciousness, whether mentioned or not. Please let me know in the comment section as well. But tendon weakness and ataxia, many students had confirmed me. So this was a case of Wernicke's encephalopathy, and please try to understand, all of you would have marked the answer correctly as thiamine beta, right? Most likely vitamin deficiency that would have led to this condition, thiamine deficiency. Not the picture of folic acid deficiency, macrocytic anemia, like those features are not given. Riboflavin, angular stomatitis, glossitis, those features are not given. And also not the niacin one. Niacin we had seen in the last MCQ, that was the dermatitic pattern, 4 Ds of pellagra, all of you already know, dermatitis, diarrhea, dementia and death, right? Now moving further, which of the following would inhibit complex 4 inhibitor? Complex 4 was an expected question this time, and definitely all of you would have marked the answer as cyanide beta, right? Hope all of you would have got this one correct. Oligomycin, that is actually the complex 5 inhibitor, no confusion beta. Phenobarbital, barbiturates group of drugs, please try to remember that basically blocks the complex 1. And antimycin A and British anti-leucite, all of us know that is a complex 3 inhibitor, right? So cyanide was the complex 4 inhibitor, oligomycin complex 5 inhibitor, phenobarbital, that is primarily the barbiturate group of drugs, that is complex 1 inhibitor, and antimycin A, please try to remember beta, that is complex 3 inhibitor. Inhibitors topic we had studied in detail during our classes at MIST, and I hope all of you would have marked this one correct without any confusion, right? Moving further beta, fifth one, 40-year-old female presented to OPD with foamy lesion present on the eye. This is also again an debatable question. Many students told that there was one image of bite hot spot which was given, and many students also confirmed me that sir, no image was given and there was only mention of foamy lesion present on the eye. And all of you know eye changes, eye deformities, eye pathology changes. First you have to think about this vitamin A deficiency, right? Vitamin A deficiency. Please let me know in the comment section as well whether they asked about the clinical features like bite hot spots in the options, or they just simply asked about the vitamin deficiencies. This time remembering the question, recalling the question would have been very difficult for the candidates because huge amount of story based questions were given. I hope this is the format in which they had given. Please do let me know in the comment section in case any mistakes has happened here, right? So please remember this. Now fasting state, basically feed fast cycle, they had also asked a question on this. In fasting state, secretion of glucagon aims to produce glucose mainly by, again repeated feedback. Finally I have been able to frame this question. Hope this is the format in which the question had come. So we all know glucagon is the principal player or the major player during our starvation or the fasting states, right? And they had asked about how glucagon helps in the production of glucose, right? We all know glucagon, whenever primarily is acting in the fasting state, it basically stimulates two pathways. One is it is stimulating the glycogenolysis. We all know this, that is the glycogen breakdown primarily in the liver and the muscle. Liver glycogen used in the maintenance of the blood sugar level, glucose production, and the muscle glycogen is used in the muscle only for the production of ATP or for the energy consumption, right? And we had also heard about gluconeogenesis, right? Gluconeogenesis. They had asked about production of glucose by the help of glucagon, right? So this is the two thing, and definitely you would have all marked the answer as option number B here, beta, that is gluconeogenesis and glycogenolysis. Please remember beta, there can be the first option which we might think as well possible. Please try to understand. Once there is a gluconeogenesis, that is the formation of new glucose from non-carbohydrate sources, once this new glucose is produced, then that new glucose can also be broken down by glycolysis. But that glycolysis is not from the carbohydrate that we are eating, because we are talking about fasting state, right? So even during fasting there might be glycolysis followed by gluconeogenesis, but as we have option number B, gluconeogenesis and glycogenolysis, this is a better answer. But please try to understand, if they would have given option A, glycolysis and gluconeogenesis, this is also partially a correct answer. Please try to follow this here, beta. First there will be gluconeogenesis, then it will be followed by glycolysis. Once we have new glucose, that new glucose can be also broken down by glycolysis, right? But as we have a better option here available, we have to mark for that, that is glycogenolysis and gluconeogenesis. See, glycogenesis is not possible because we are talking about fasting state. Glycogenesis is only possible by insulin in a well-fed state, right? And only gluconeogenesis, no. Only glucogenesis, no, because we first have glycogenolysis followed by gluconeogenesis. First pathway activated, glycogenolysis followed by gluconeogenesis, right? Definitely all of you would have marked the option number B as correct. No confusion here, beta. Moving to the next one. Boy presented to OPD with voracious appetite. This is the word that I have heard from many students, beta. Voracious appetite, and there was also mention of overall swelling of different body parts. Few students also told me that sir, there was mention of directly as edema. There was no mention of any anasarca like word. But please remember, boy presented to OPD, voracious appetite, this word was given. This is the word that was highlighted, voracious appetite, overall swelling, that means pointing towards edema. And particularly this is a case of protein energy malnutrition, PEM. And we have the three forms of protein energy malnutrition. All of us know we have marasmus, kwashiorkor and marasmic kwashiorkor. Please remember the best answer possible from this. All of you would have definitely marked the answer as kwashiorkor, beta. Kwashiorkor, isolated protein deficiency, overall calorie is intact. So these children, they basically look fatty, also known as fat sugar baby, also was asked in previous exam of FMGE recently, right? So fat sugar baby, edema, voracious appetite, Please remember, kwashiorkor is the answer that you must have chosen, right? I hope all of you would have chosen this. Bulimia nervosa, that is overeating, that should not be the answer. Marasmic kwashiorkor and kwashiorkor, if you are asking me for the choice, definitely kwashiorkor will be a better answer, because in marasmic kwashiorkor we do not, and they had also talked about the different body parts. If there would have been only mention of isolated pedal edema, then this might be also answered as C. But as they had mentioned about different body parts, please remember, then the best answer to be chosen as kwashiorkor. Kwashiorkor, right beta? Important point to be noted. Hope you would have all made this one correct, right? Now this is a question which took really some time to recall, because this was preferably a new question. This was asked for the first time in FMGE, and they had asked about some type of hexokinase, but I hope all of you will be able to recall it now, that there was a question on type of hexokinase that is released from hypothalamus. Hypothalamus releases which type of hexokinase? During our classes at MIST, we had seen hexokinase had 4 isoenzymes, right beta? 1, 2, 3, 4. And please try to understand beta, the fourth one, hexokinase 4, is also known as glucokinase. These are the isoforms, right? Isoforms of hexokinase. Type 4 hexokinase is also known as glucokinase. Principally, glucokinase is found in the liver, in the pancreatic beta cells, Please try to understand, this was a bouncer question this time. Apart from liver and the pancreatic beta cells, hope you guys can see it. Please remember the third option, glucokinase is also released from hypothalamus beta. The answer to this question is that hexokinase 4 or glucokinase. Please try to understand this beta. This was a bouncer question this time. It was never asked till date in FMG, but this time they had asked this, that which type of hexokinase is released from hypothalamus beta. Hypothalamus releases hexokinase type 4, which is also known as glucokinase beta. Apart from this, you can also remember this glucokinase is also released from intestine and any cell of neuroendocrine origin. Please try to understand this beta. Neuroendocrine origin. Please remember this beta. Regarding hexokinase 1, all of you know this is the most abundant one. This is the most abundant and almost found in all tissues. And that's why also denoted as housekeeping type of enzyme. Please try to understand beta. The first one is also known as housekeeping type of enzyme. Right, important point to be noted. Regarding hexokinase 2, all of you would remember that we had discussed predominant form in muscle and also the predominant form in heart, right? We do not have much of info available for the hexokinase 3 till now. The research work is being done, so let us not talk about that. But basically this was a bouncer question, and the answer to this question was beta hexokinase 4 or glucokinase. Those of you who would have marked the option as 4, really clap for you guys beta. We have to go for some educated guess. Please remember, 1, most all tissues, 2, we know muscle and heart, 3, okay, we can somehow try to rule it out. And if you would have marked the answer as hexokinase 4, really thumbs up for all of you guys beta. Please remember the answer to this question was glucokinase, coming out of hypothalamus as well. Usually this is coming from liver pancreatic beta cell that contributes almost 90% of the HK4 or glucokinase that is available in our body. But some minor areas, some rare areas are hypothalamus, intestine and any cell of neuroendocrine origin, which collectively contributes to only 10%, right? Coming to 9 beta, please try to follow this. Patient was diagnosed to suffer from carcinoid syndrome with associated heart disease. Again, debatable question. Many students had given me some other type of history, but most of the students had given me that there was mention of carcinoid syndrome with a patient of heart disease. What's the active metabolite released in the urine that would have helped in diagnosing the carcinoid syndrome? Whatever the story might be, they would have given you something to distract. But the crux of the story is, how do you justify that it is a case of carcinoid syndrome, right beta? And I believe all of you would have definitely marked the answer as 5 hydroxyindole acetic acid. Just now in today's recall session discussion as well, we have just told you that 5 hydroxyindole acetic acid, 5 HIAA. Please remember, we also have some other markers like synaptophysin and all those neuron specific enolase and all those, but those are not mentioned here. Basically, you have to choose the best possible answer, 5 hydroxyindole acetic acid. Phenyl acetic acid, I just now told you, it is seen in case of PKU. Vanillyl mandelic acid, that is particularly in case of pheochromocytoma. Acid to acetic acid, it is actually a ketone body, right beta? So the answer to this question was 5 HIA. This is again a bouncer type of question, carcinoid syndrome with associated heart disease. Please remember beta, there is a one entity which is actually asked in PG exams as well. There is something known as carcinoid heart disease. There is something known as carcinoid heart disease. This is a rare form beta. Please remember, this is also in short sometime denoted as CHD. Carcinoid heart disease is a separate entity beta, tough topic, but just try to understand carcinoid syndrome can be developed in a patient who was already suffering from heart disease, and particularly once you have this neuroendocrine type of tumor, carcinoid, malignant carcinoid syndrome, argentophiloma. Please remember, basically you have a right sided heart failure in this sort of patients. Please try to follow me here beta, that carcinoid heart disease, carcinoid syndrome in a case of heart disease patient, if it is developed, most commonly it is the right side of the heart which will be going for some pathological changes. There might be some valvular defects which can be possible, and it will lead to right sided heart failure. So the answer to this question straight away, 5 hydroxyindole acetic acid, right beta? Hope you would have made this one correct. Coming to number 10, again a debatable type of question, different type of histories had surfaced, but this is the most voted type of history that would have come in your exam. Postmenopausal female presented to OPD with sudden abrupt swelling of metatarsophalangeal joint. Many students were also telling me about some metacarpophalangeal joint, but I believe definitely they would have mentioned about metatarsophalangeal joint meta, and they had also highlighted that these words were there, sudden abrupt swelling. Sudden abrupt word was there, swelling of metatarsophalangeal joint after consumption of alcohol consumption, after consumption of alcohol in a party last night. Sorry, in a party, print typing error, in a party last night, right? Consumption of alcohol in a party last night. Physician on duty prescribed medicine for the same. Which of the following would have been inhibited in treating the condition? So basically it is a picture of gout beta, picture of gout. Gout is very common in middle-aged elderly male and post-menopausal female, because after menopause we have sudden abrupt decrease in the estrogen content, and estrogen is protective as compared to uric acid deposition. So please try to understand, as there is a estrogen defect or deficiency suddenly after the menopause, so there is a high chance of acute attack of gout. So this is a picture of acute attack of gout, and please remember the doctor would have definitely prescribed medicine against xanthine oxidase, right? I hope all of you would have marked this one correct. If it would have come, definitely you would have marked this was as correct beta, xanthine oxidase, right? Allopurinol can be given. We also have some novel non-purine analog inhibitor like febuoxostat and all those, right? I'm not going into that. So please remember, if you would have faced this question, definitely you would have marked the answer as xanthine oxidase, right? Moving further, this question was definitely asked beta. Peripheral conversion of T4 to T3. During our classes at MIST, we had also discussed about that we have an enzyme called deiodinase beta. Please try to understand this deiodinase. We had discussed it is a selenium dependent, right? Selenium dependent enzyme, which is also selenocysteine containing enzyme, right? Selenium dependent enzyme, selenocysteine containing enzyme. Deiodinase, the job of this deiodinase is to convert T4 to T3, active form conversion, deiodinase. Please remember, tyrosinase not the answer, thyroperoxidase, TPO was given in one of the option, not the answer, and thyrotropin releasing hormone definitely not the answer, right? Hope you all would have made the answer correct by marking deiodinase. We had discussed this beta, we had discussed this. T4 T3 conversion happens peripherally by deiodinase, right? right? Selenium content, during the metalloenzymes topic we had talked about this. Selenium containing, that means selenocysteine containing as well. 21st amino acid is a part of this deiodinase, right beta? Coming to number 12, definitely this question was asked, and the keyword that I had received from many students was tingling sensation. tingling sensation, which of the following vitamin deficiency? tingling sensation है तो आंख बंद करके हम लोग मार्क करते हैं क्या बेटा? हम लोग मार्क करते हैं विटामिन B12 deficiency, बट वो तो ऑप्शन में दिया ही नहीं है. Please try to understand. Tingling sensation most commonly seen by which vitamin deficiency? B12 deficiency. B12 deficiency. If B12 deficiency is not there, second best option available is B9 deficiency, but वो भी option में नहीं है. Third best option possible that we have is B1 deficiency. Fourth possible is D deficiency. Please, the answer to this question was thiamine, most likely. Tingling sensation, B12, B9 not in the option, so B1 is the best possible answer from this question, right? Yeah. Moving to the next question, definitely this question would have been was asked. I am not sure about the language, exact language of the question, how they had asked, but there was a question on the Michaelis-Menten graph or the Michaelis-Menten equation, how, which of the following is true? Please remember they had asked about the Km and the relationship with various factors. What is Km? We all know Km is nothing but the substrate concentration at Vmax by 2, right? At half maximal velocity, to achieve this, the amount of substrate that must be present in any biological system so that the reaction can take place, right? So please try to understand, we all know Km has everything to do with substrate, nothing to do with enzyme, nothing to do with product, right? Basically it is the substrate concentration with which the reaction speed can be achieved till Vmax by 2 or half maximal velocity, right? So please remember, let us see the options one by one. Directly proportional to substrate concentration, yes, that is the correct answer here. Directly proportional. As Km increases, that means more and more substrate also has to be given to that particular reaction so that it can achieve Vmax by 2. What about the other options? Let's quickly let us have a look. Directly proportional to enzyme concentration, no relationship with the enzyme. Inversely proportional to substrate, no. Directly proportional to substrate, and no relationship with the substrate concentration also is a wrong statement, right beta? So please try to understand. By simply we can remember the answer as directly proportional to substrate concentration. Please do let me know in the comment section. This question we were not able to exactly recall or remember how the language of the question was framed, but I hope the crux of the story or the relationship between enzyme concentration, substrate concentration and Km, we all know. Km has everything to do with substrate, nothing to do with enzyme concentration, right beta? Hope you would have all made this one correct. Yeah, this question also was asked in your exam. Middle-aged patient or worker revealed have suffered from one rare form of pyruvate dehydrogenase deficiency. This is the crux of the story beta. There was a question on pyruvate dehydrogenase deficiency, for which he had developed high ANANGAT metabolic acidosis or HAGMA, right? This we had also studied during our link reaction classes between glycolysis and the Krebs cycle. We all know glycolysis and the Krebs cycle, they are linked by pyruvate to acetyl CoA, right beta? And this enzyme which converts this, we all know this is the pyruvate dehydrogenase complex, right? So if you have a deficiency of this pyruvate dehydrogenase complex, if this enzyme is deficient, what we will be having, basically there will be increase in the concentration of pyruvate, and this pyruvate has nowhere else to go apart from this lactic acid conversion, because the major fate of pyruvate is to get converted to acetyl CoA so that the Krebs cycle further can happen, because the acetyl CoA can enter into the Krebs cycle, right? All of you know that. Now here what is happening, the principal function, principal pathway is blocked. Rare form of disorder, right? This is a rare form of disorder. So acetyl CoA production is not happening, pyruvate is excess, alternate available pathway gets activated, and pyruvate can be converted to lactic acid or lactate by the lactate dehydrogenase enzyme. All of us know this, right? and this lactate ultimately it can cause metabolic acidosis like picture with an high anion gap. Now what is the best dietary advice that should be prescribed for this from the following for this particular patient? Now let us see. See, ultimately what is the major culprit here, beta? The major culprit here we can all understand is the increased level of pyruvate, right? So we should not do anything further that will worsen the condition by increasing the pyruvate. See, pyruvate, what are the sources? Principally, it is the carbohydrate glucose that we consume that is converted to pyruvate by the process of glycolysis, right beta? So first thing, we have to decrease down the intake of carbohydrate, right? No confusion here in this one, right? So let us try to see the options one by one, and let us try to choose the correct answer. Only carbohydrate intake henceforth. No, this will be a blunder. We cannot feed this particular patient more and more carbohydrate, because again it will worsen the condition by increasing the load of pyruvate, by increasing the load of lactate further, right? High carbohydrate, low fat. So again high carbohydrate, no, it can't be the option. Third option is the right answer here beta, because high fat and low carb intake should be given. Why? Please try to understand here beta. High fat, once you consume, fat will be broken down by the beta oxidation and it will be releasing this acetyl CoA, right? And this acetyl CoA will be able to enter into Krebs cycle, because nothing wrong in the Krebs cycle pathway. Acetyl CoA metabolism further is possible. It is the only problem where pyruvate to acetyl CoA conversion is jeopardized, right? So we should not do anything which will increase the level of pyruvate. Let us try to see the last option one more time. Please try to see here beta. High protein, they have told. Low carb is good, but high protein, once you try to consume high and try to protein, please remember protein also will be broken down. It will be also can be broken down till the level of acetyl CoA, and protein during this breakdown, once they will be releasing this amino group, there is a high chance of transamination process. ज़्यादा प्रोटीन खाएंगे तो प्रोटीन ब्रेक डाउन होगा, वी नीड ट्रांसएमिनेशन, राइट? एंड प्लीज रिमेंबर बेटा, ड्यूरिंग ट्रांसएमिनेशन ऑफ alanine and few other amino acids, these amino acids can also be transaminated to pyruvate. So again protein can also increase the level of pyruvate because of high chance of transamination. You all know that enzyme ALT or SGPT in the liver, alanine transaminase, or serum glutamate pyruvate transferase. So pyruvate transferase, alanine will be converted to pyruvate, again the load of pyruvate will be increased, again it will worsen the condition. So right, so protein intake should also be decreased down, but mainly we have to cut down the intake of carbohydrates. So the right answer to this question is beta, high fat and low carb intake, right? Hope all of you would have applied your knowledge concept and definitely you would have marked this one correct, right? Again, this is as close as possible we can reach to the crux of the story. Maybe the language was a bit difficult or different in the exam. Tall obese, these two words was there. Tall obese patient was worked up to have recently developed metabolic syndrome. There was a question probably on metabolic syndrome beta, and which of the following is most likely to be found in this particular patient? See, metabolic syndrome we all know, particularly this is a problem with high BP. First thing, high BP, hypertension, blood pressure. There is also high sugar, high chance of type 2 diabetes mellitus. We also have lipid profile deranged in metabolic syndrome, also known as syndrome X, right? American syndrome, syndrome X, metabolic syndrome. US population, they suffer from this metabolic syndrome because of burger, KFC, McDonald's, right? So high BP, high blood sugar, deranged lipid profile, that means high triglyceride as well as high cholesterol, particularly LDL type of cholesterol will be high in this patient. So let us try to see which of the following is most likely to be found in this patient. Uric acid increased, insulin increased. No beta, no, this is not possible. Please try to understand, insulin if it is increased, it will counter the hyperglycemia. They will try to maintain normoglycemia, but in cases of metabolic syndrome we have hyperglycemic states, right? So this cannot be the answer. Uric acid, no. No gouty picture, nothing wrong. Increased triglyceride and total cholesterol. Yes, this is possible. Definitely this is possible, beta. So let us try to keep this is one of the option that is possible. Triglyceride, TG, TAG and total cholesterol or LDL. Few questions told me, sir, they had given total cholesterol. Few students told me that they had given LDL. I believe one of them would have been given. Definitely total cholesterol or LDL would have been given. Increased blood pressure and increased insulin. No, increased blood pressure, this part is true, this part is true, but increased insulin, this part is not possible, beta. Then again increased blood pressure, this part is again true, and increase in serum calcium that they had told, this is again partly false. So please try to understand the best possible answer to this question we can remember, that is increased triglyceride and increased total cholesterol or LDL level, right? So important point to be noted, beta. Hope you would have all applied your concept and knowledge in making this one correct, right? But a metabolic syndrome, increased triglyceride and increased total cholesterol and LDL, right? Beta, important point to be noted, right? Feedback had been received that this question was also asked. Which of the following would help in explaining mechanism of ANP or atrial natriuretic peptide? Right, beta, atrial natriuresis. So sodium water retention is prevented and more sodium and water will be thrown out. So please try to understand one of the mode of action of this atrial natriuretic peptide apart from preventing sodium water retention, it is also that they go for vasodilation. Please try to understand, beta, they will also go for vasodilation. Natriuresis, more and more will be thrown out, right? Vasodilation, and one of the mode of this vasodilation, we also know there is a release of nitric oxide. And please remember, we all know the nitric oxide, the second messenger system that will help in the release of this nitric oxide, it is cyclic GMP, right, beta? This is cyclic GMP. I hope this question was asked and definitely you would have all marked the answer as cyclic GMP, beta. Please try to understand, vasodilation has to happen for the atrial natriuretic peptide to work to its full potential. We require release of nitric oxide by activating second messenger system of cyclic GMP, right? That will cause for dephosphorylation of the myosin light chains and there will be widening of the vessels, vasodilation will be there, cyclic GMP. Hopefully this question was asked. We are not sure about these three questions, beta, that we had received multiple feedbacks but we were unable to come up with the exact story that they had cooked up in the exam hall. If any of one of you can help me out with the comment section that in which form they had given. There were some questions on type 2 diabetes mellitus, that which product will come out in urine, something like that, or what metabolites are increased in blood, something like that. We are not sure, we are not able to recall it correctly, beta. There was also one question on where they had mentioned about some long chain fatty acids, either enzyme deficiency or some long chain fatty acids are increased in blood. Please try to recap or recapitulate if you can remember those. Please do let me know in the comment section. And a few students also told me, sir, that they had asked some questions on particular question on Atkins diet. I believe that Atkins diet question may be somewhat close to that metabolic syndrome diet that we were discussing about, maybe something like that, TG or something. We are not sure, I mean, because multiple feedbacks have been received and there would have been some question like some, maybe they are related to this question number 14, that how, I mean, fat and low carbohydrate also, I mean, coincides with that Atkins diet, right? Low carbohydrate, high protein ketogenic diet, so maybe they are confused with that, so not sure. In case there was a separate question on Atkins diet as well, please do let me know in the comment section as well. And so with the best possible effort of the students of MIST, we have been able to gather only this much these many questions. I believe the information was helpful for you guys, and now just let's sit back, relax, enjoy, and just wait for the great results for all of you. In case any disparity is there, so folded hands, excuse me for that. And we have just tried to bring it as close as possible to the real question that was asked in your exam. So do let me know in the comment section. Hope this session was helpful for you guys, and praying for your success, praying for your great results. Wish you all the best, and may every one of you pass with flying colors. God bless, and wait for the great result.